California cigarette and tobacco taxes.
Okay, thank you again, Chair and members. SB 591 proposes a new $2 per pack tax on tobacco products to save the lives of Californians suffering from deadly and preventable diseases and prevent more youth from using tobacco in the first place. Tobacco use is the single most preventable cause of death and disease in California, claiming the lives of nearly 40,000 people each year. California has approximately 3.6 million adult smokers and over 220,000 youth smokers. African Americans, the LGBT community, and lower income Californians smoke at disproportionately higher rates than the general population as a whole. Treatment of cancer, heart disease, and stroke, lung disease, diabetes, and other diseases related to tobacco use continue to impose significant burden on California's overstressed healthcare system. Smoking-related diseases costs our state roughly $13.3 billion in medical expenses each year, and almost $3 billion are taxpayer dollars used to treat Medi-Cal patients with tobacco-related illnesses. In addition, the cost of lost productivity due to the use of tobacco is estimated at $10.4 billion annually. California has not increased its tobacco tax since 1998, and at 87 cents per pack, currently ranks 33rd in the nation for tobacco tax rates, in fact, lower than Texas. 18 other states have tobacco taxes proposed in 2015, but their passage won't be easy. Last year, Big Tobacco killed 22 attempts to raise tobacco taxes across America. And increasing the cost of tobacco is widely recognized as the most effective way to reduce smoking across California, particularly by young people. The tobacco industry knows this, and that's why they spent millions to try to stop them, despite the obvious benefits to society from having our youth not smoke. A $2 per pack increase will generate $1.5 billion in revenue in the first year alone. Some of the funds raised by this bill will increase the capacity of proven statewide prevention and education programs that reach adults and youth alike through the media, schools, and workplaces. SB 591 will provide much needed revenue to improve access to health care for low-income Californians and families and individuals, including treatment of cancer, heart disease, stroke, lung disease, and other tobacco-related diseases related to tobacco use, diseases that currently are being paid for by taxpayers. SB 591 will also expand frontline law enforcement programs to prevent underage sales and tobacco tax evasion. Save Lives California is a coalition that represents a broad and diverse coalition committed to healthier Californian. We are doctors, nurses, taxpayers, healthcare workers, and families who have lost loved ones to cancer, lung disease, and heart disease. I respectfully ask for an aye vote, and I have witnesses in support. Thank you.
Okay, Gordon.
Good morning, Alicia Sanchez with the California Medical Association. We're pleased to be a co-sponsor of SB 591 and its companion legislation, AB 1396. As Dr. Pan mentioned, smoking-related diseases are the world's most preventable cause of death, and our members, our 40,000 members, know that firsthand. They are in the trenches trying to treat cancer, chronic bronchitis, emphysema, cardiovascular disease, and the risks of early delivery or stillbirth of babies, increased risk of SIDS, all of these things that are tobacco-related. And our physicians would like to continue to have an emphasis on prevention, because in many cases we have good clinical tools at our disposal, but in others we don't. So for example, with lung cancer, the 5-year survival rate is only 17%, and smoking accounts for the majority of lung cancer cases. So we inherently understand the benefit of prevention, and increasing the tax alone is a prevention tool, because we know that many youth will never start smoking because of the increased rate, and many people who are currently smokers will stop smoking. And so for that reason, we support the tax. And then we also know that the way that the tax is being proposed to be allocated will also encourage prevention. So we urge your support today.
So much.
Good afternoon, members. Kimberly Amazine with the American Lung Association, California. The numbers really tell the story here. We've outlined for you all the ways that raising the tobacco tax will keep kids from ever starting to smoke and will invest the money in proven and effective programs. First, the prevention program. When you talk about being fiscally responsible. You can look to the California Tobacco Control Program. It's been a over 20-year, $2.4 billion investment, and the return on that investment for the taxpayers in the state of California is over $134 billion. That is an appropriate way to raise a tax and invest the money in sound, proven measures that save this state a lot of dollars. We also know that the most vulnerable populations in California are in need of better and improved access to care. This bill will also do that.
Can I just ask you a question? What if you're successful on this, really successful?
Okay.
And success is, in your point of view, as a lung association, to stop everybody from smoking. That means there's not a penny of tax created because there's no cigarettes sold because nobody buys them.
That's success.
That's success.
You win.
But is that success also in the sense that money's being used for all other purposes, right? To fund medical care and all these other things, which I totally support, but I mean, it's just, I always found it to be a lot.
I think the big question is e-cigarettes, why they can't fit in this, because that's where the younger people are headed.
And may I respond, Mr. Chair? Yes, it'll be a total, our success would be we would have no one smoking. We would not raise a dime of revenue from this bill, and taxpayers would not be paying the cost of tobacco-related diseases. Now, realize there'll be a lag time because we have people smoking and those diseases will continue, but we will get to the point where we're not paying for that. Taxpayers aren't paying for that, workplaces aren't paying for that, families aren't paying for that.
Yeah, I mean, I've been through this. I was co-chair of Prop 10 in 1998. That was 98, something like that. I can't remember. It was with Rob Reiner stuff, and you went through all this analysis. But that was 50 cents. This is $2. But go ahead. I'm sorry.
It's a great question, and it's true. I mean, success is having less people smoke. There's a nexus between raising the tax and investing it in both prevention and improved access to care. So what we do know is that tobacco taxes are one of the most predictable and stable taxes. So as you see declining revenue sources, you can predict that. You can see that you're having impact on
And like in
better
states like New York, where it's, I don't know, it's how much is a pack? It's like $10 to buy a pack of cigarettes or something like that. If you look at the diagnostic there to see how much revenue you get, and A, has it either A, produced revenue, or B, reduced smoking, what's the impact on those real heavy states that tax big?
They've seen immediate drops in their youth smoking initiation rates because kids are so price sensitive to raising the price of a pack of cigarettes. So there's an immediate drop, and we can share with you those studies that show that there's an immediate impact on raising that tax. And then there's certainly the effect over the next 2 to 4 to 5 years. We've seen that with the California Tobacco Control Program. We've got the data to show how it works in California. We expect the same thing to happen as we look at raising our tax to address what's become still a burden on Californian taxpayers, and certainly for those who need our help the most to help them quit.
Thank you. Others in support?
Mr. Chairman, Senators, Terry Brennan on behalf of Service Employees International, the largest healthcare workers union in California. You have a unique opportunity today to cast a vote to save lives, stop kids from smoking, fund tobacco research and cancer research, to fund anti-smuggling efforts, and to defray the cost, the enormous cost to Medi-Cal of smoking-related diseases. You asked, Mr. Chairman, what would happen if we were successful and nobody smoked? That would be somewhere between $6 to $8 billion less just on the Medi-Cal side of smoking-related diseases. That's our eventual goal. For that reason, we're asking for an aye vote.
Very good. Senator Hernandez, you had a question?
Question, not necessary, but I have some comments, and when appropriate, I'd like to move the bill. I'm very supportive, obviously. The comments I have is, and I'd like to just follow up with what were made earlier, is if you think about nicotine and smoking, nicotine is an addictive product that ultimately will lead to death. There's all the unintended consequences from emphysema to disease to diabetes, and the healthcare costs to our system are astronomical because of tobacco. The other thing, too, is if you look at the state of California, we are way behind the rest of the states for raising the tobacco tax. I'd like to amend it to $4 a pack if we could, but I'm supportive of the two. And we need to use those dollars for reinvesting in education, smoking cessation, but more importantly, perhaps maybe even to Medi-Cal reimbursement rates to try to get more providers to see these patients. So I am extremely supportive of it. I just want to make a statement, so I don't have any questions per se, but when appropriate, I'd like to move the bill, Mr. Chair.
Okay, good. Others in support?
Good afternoon, Mr. Chair and members. Sawait Sim on behalf of Health Access California. We are the statewide consumer advocacy coalition on healthcare, and we're here in support on SB 591 and companion legislation SB 1396. We believe that SB 591 will be tremendous in increasing capacity of proven statewide tobacco prevention and education programs. And with respect to California's leadership, we are a leader on so many issues throughout the nation, and this bill will restore our leadership in smoking prevention and research. Lastly, SB 591 will reduce costs to our healthcare system overall, and for those reasons, we are in support.
Thank you so much.
Paul Neprath, on behalf of Planned Parenthood affiliates of California, 115 health centers throughout the state, seeing about 1.5 million patient visits a year. We're in strong support of this legislation. We're a Medi-Cal provider, and it's critical that we do something additional to reduce the cost of the Medi-Cal system. We're all trying to do more on rates and to stabilize the infrastructure that is Medi-Cal, and we're in strong support. Thank you.
Thank you, sir, very much.
David Ford, on behalf of the Medical Oncology Association of Southern California, the Association of Northern California Oncologists, we're in support of the bill. Thank the author for bringing it forward. Thank you.
Thanks, sir.
Good afternoon, Callie Hampton on behalf of the American Heart and American Stroke Association. Heart disease is a leading killer of men and women in the country, in large part related to tobacco use. We're a proud co-sponsor of this bill, and we urge your aye vote.
Thank you.
Tim Gibbs with the American Cancer Society Cancer Action Network, and we're a proud co-sponsor of the bill, and we urge your support.
Thank you so much.
Jasmine Gordon with the California Black Health Network, and strong support.
Thank you, John.
Kimberly Chen with the California Pan-Ethnic Health Network, and support.
Thank you.
Brandon Roberts here on behalf of the Health Officers Association of California. We're standing in support.
Thank you.
Mr. Chairman and members, Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, in support.
Thank you, sir, so much. Opposition? Yeah. Okay. Yep, Brennan, roll. Okay.
Mr. Chairman, members, good morning. David Wolf with the Howard Jarvis Taxpayers Association. We're opposed to this bill. And Mr. Chairman, I think you made a very good point just a few minutes ago in that there is a tension here, there is a conflict, and there is a reason why these are called vice taxes. Legislators want the money, but we also want to encourage people not to smoke. Senator Hernandez brought potentially using the money for Medi-Cal reimbursement rates, which I think is arguably pretty important, especially in rural areas. But which is it? There is a contradiction there. And I do think that needs to be addressed, and I don't think a $2 cigarette pack tax on cigarettes accomplishes that objective. I think it confuses it even more. And I'd also like to make the point that the more we increase taxes of this type, the more we drive a lot of this revenue underground and make it harder to get. I've sat in numerous Board of Equalization meetings on the underground economy and issues with that, and certainly a $2 increase and definitely a $4 one as well, I think only makes it more difficult to get this revenue. So for those reasons, I'd ask for a no vote.
Thank you, sir.
Mr. Chairman, James Jack here on behalf of the Cigar Association of America. While we don't know that the cigar industry is the primary target of Senator's bill, because the tax rate on cigars in California is calculated based on the cigarette tax, the implications to the cigar industry are going to be devastating. For example, if you can imagine a Macanudo cigar that has a wholesale cost of $10, under this proposal, the total cost of a box of those cigars that has a wholesale value of $250 would be nearly $650. That's a $400 tax on a $250 box of cigars. That will be the death knell of the cigar industry in California, and for that reason, we ask for your no vote today.
Mr. Chairman, members of the committee, thank you very much. My name is Rich Marianos. I'm a 27-year law enforcement veteran, former retired assistant director with ATF, and currently on staff as a professor at George Washington University. My proffer is much different. It's to bring to light the nefarious means that tobacco products do cause in terms of being used by organized crime as criminal currency for terrorist gangs, organized crime, the mafia, that it's become the new currency. And something to bring to your attention that because of the disparities in the pricing and because of the logistics of some states with higher taxes and lower taxes, it's created an issue where some very sophisticated criminal networks have been using tobacco products for nefarious means, and it's caused a great concern for law enforcement in the last 5 years. Currently, the United States in the loss of taxes from the illicit tobacco trade is around $10 million. In California specifically, right now, we're looking at a tax loss of over $136 million of money that's going out of the window because of lack of strong enforcement and prosecute efforts to these type of criminals. The type of crime that is being committed by trading tobacco is much easier now for criminals to trade tobacco than it is cocaine, heroin, or guns. It's what it really resolves to, and it's very easy to understand, is it's zero risk and great reward. No one's going to jail for tobacco crimes in this country, but they'll go to jail for a pound of heroin, they'll go to jail for a pound of cocaine, but a tractor-trailer load of cigarettes they may get probation for. So that is a result for criminal organizations to get involved. For evidence-wise, and you brought up New York, Mr. Chairman, and I wanted to bring this up for your edification because you asked that question. I partook in that study and had a lot to do with the enforcement in New York right now. Yeah. Right now, 60% of all the cigarettes consumed in the city of Manhattan are either counterfeit or smuggled in. So what they're using for their value, in terms of their tax value and their tax idea, is much different than the reality that's happening. And this was done from criminal proffers, evidence, wiretaps. This was all put together in this study to demonstrate that it's much different than the using of the product than what is being brought in and actually smoked. Our position, in terms of
law, it's a lot easier to bring stuff in New York. You got about 10 states there the size of LA. They're all small states. It's easy to just drive across the bridge from New Jersey or drive in from Connecticut or these other places and move in stuff, as opposed to California, which is a whole different place.
Yes, but it's a very similar dynamic if you're traveling from Arizona, Nevada, or Washington State, bringing them in, or bringing in counterfeit from Canada, which is a big problem. And I know just recently the Homeland Security Division conducted a case in Los Angeles where a group of individuals of Armenian descent were bringing in counterfeit cigarettes and destroying the state of tax base and financial resources. What I wanted to pretty much proffer here, and I'll leave it at that, is the most important thing we need to concentrate on with this is a greater law enforcement approach to this to stop the amount of money that we're losing in terms of the criminal use of tobacco products and the type of criminals that are using it to trade, to have better laws so these career criminals and these organizations that are now switching from narcotics, guns, and other forms of criminal activity are going to be punished for the criminal sale and illicit use of tobacco products, and greater political awareness that this is not a mom and pop operation. An example, I'll give you one case example and then I'll quit for now. In 2013, Operation Tobacco Road, it had members of Al-Qaeda from the Arab Peninsula specifically using tobacco products, bringing tobacco from Virginia to New York. From that higher tax rate that you talked about, somebody that was able to purchase a pack of cigarettes for $4 and sell them in New York for $15, that was selling large amounts, bringing them from the state of Virginia to New York and funding terrorist cells directly in Yemen. That's the type of criminals that are getting involved in this, and I think that's one of the reasons we oppose tax hikes in these various areas.
Thank you. Sir, thank you very much.
Peter Walker with the California Taxpayers Association, and we believe the state should be reducing its reliance on declined revenue sources such as this, so we oppose this bill and urge a no vote. Thank you.
Mr. Chair, members, Jeremy Mersmath, the California Chamber of Commerce, also in opposition.
Thank you, sir. Okay. Any other questions from the members? Sir?
I have a question. I wanted to talk to the witness or the author about, we talked about the price increases and that helping in the cessation of smoking. Is that the same case for low-income communities, people of color, immigrants who we know? I mean, I don't know, but it seems that they're much more prevalent in low-income communities.
Yes, unfortunately, that is true. There's both a tendency to market more and also to those communities, and we do know that there's higher use in minority communities. So that's why this bill certainly is about being sure that we help deter people, not only by raising the price, but also by providing services to low-income communities, including tobacco prevention, cessation, as well as the fact that they're more likely to be on the Medi-Cal program. So when they are suffering, unfortunately, if they do start smoking and are suffering from tobacco-related disease, they're going to have better access to care. I mean, this really is about trying to help out people who are in communities which unfortunately have been targeted often by the tobacco companies for sale of their products, which unfortunately are harming them. So we want to be...
Are the monies collected currently now prioritized in these communities?
Well, we're prioritizing the funds to go for both for tobacco control, tobacco cessation, and as well as the Medi-Cal program. So, I mean, the Medi-Cal program is focused on people who are low income. So, in fact, the bulk of the money is going to help because there's such a cost to the Medi-Cal program, and we've all been struggling with access in the Medi-Cal program and the absence of insufficient funds to provide that access. So I think that is going to, so the money will be, in many ways, through that mechanism, be targeted to communities where there's higher percentages of low-income people.
I just wonder if we can further clarify that, because these communities are targeted, and especially minority children, low-income kids from all ethnicities are targeted. So I wanted to see if there was a possibility of maybe earmarking, and then also just curious, have there been studies done on just specific these communities about what prevention exists, what are preventive strategies that exist, what are, because these might be unique circumstances to these communities, especially if you look at, in my district, our Asian kind of enclaves, very high smoking rates there as well. So is there data, is there research that's, linguistically appropriate, culturally sensitive to address the smoking issue in general?
Senator, the California Tobacco Control Program, which currently would be funded in appropriated dollars by raising this tax, definitely has community-based investments where we're looking where the need is greatest, where the prevalence rates are highest, to invest in those communities, to give them the tools and resources. The program also has materials and tools in several languages to address, language-specific communities where they can absorb the information and get the best kind of access to education. So that is currently part of the program, the California Department of Public Health Tobacco Control Program, and that would be reinvested in with the additional tax by raising the dollars and putting that reinvestment back into the program as part of the prevention piece.
Okay. I'm also I understand the criminal element. When you look at cigarettes, you would have never thought, but if you also look at piracy, when you look at all these other issues, human trafficking now, it seems like it's all they're moving from these hard illicit drugs to different, other horrible things that you never would have thought a transnational gang would be working on. And it's also difficult to see that we want to tax something that we want to have people stop using. But to me, I think, I'd rather err on the side of raising money to help the cessation of tobacco. But again, I also think Senator Pavley brought up a good issue about these e-cigarettes, which seems to be the new latest kind of fad and trend. And
that's where the middle school and high school.
And that's where the kids are starting to use it. I think cigarettes now are I think it's more kind of an old-fashioned immigrant population in my district. 50% of my constituents are foreign-born, so I see it And I think we need to provide a specific strategy for that community and then tackle the e-cigarette issue with our children.
And I just want to brief comment that this bill, there's a package of other bills as well, and I want to thank Senator Hernandez for being an author of a bill to raise the tobacco age use, and then we have another bill actually that addresses e-cigarettes authored by Senator Leno. So while this bill doesn't specifically speak to that and doesn't currently include e-cigarettes, there are bills that are working on that as well. So we do see this as sort of a overall strategy to address tobacco control. Certainly this is about both deterring people from starting by raising the cost through tax and also helping fund programs that will help people either not start or help them quit.
I think Hernandez
You already
reserved the
have.
right to.
I would like to.
Okay, Senator Pavley moves the bill. This is due pass to Health Committee. Aren't you the chairman of Health Committee, sir? Okay,
I know the chair.
Okay.
thank you. Secretary Open Roll.
Hertzberg?
Aye.
Hertzberg, aye. Wynn? Bell? Aye. Bell, aye. Hernandez? Aye. Hernandez, aye. Laura?
Aye.
Laura, aye. Morlock? No. Morlock, no. Pavley?
Aye.
Pavley, aye. You have 5-1.
5-1, we'll hold the roll open. Thank you very much. Senator Pan, Senator Bell.
Thank you.
Mendoza's not here, is he? We got to call Mendoza. We got one more bill. If you can call Mendoza. Senator Bell, why don't you come up on SB 377, file item number 3. Thank you for your patience. Senator Bell.
Almost done.
Almost done.